is a mask which is going to make a seal inside the oral cavity, and it will make a seal so that there are two fenestrations in the hollow side of this mask. That through that fenestration, whatever gas we apply, mostly oxygen, that gases will go, and even if some of it goes to the stomach, to the oropharynx and the esophagus, but definitely amount of it will go to the trachea, via the trachea to the lungs. So that is the beauty, and this is a deflatable cuff. This is a kind of a seal makes inside the mouth, and the one most important advantage of using this is you do not require a laryngoscope for this. For with your bare hands, you can just introduce it through the curvature of the hard palate. Introduce it like this, like a pen hold it like that, go back into the mouth so that the teeth touches the hard palate and move it along the hard palate into the mouth. So your movement is like that, and move it as far as possible into the mouth as far it goes, and then release that hand, hold it with the left hand, and then inflate the cuff. There is this is written that how much air it should be inflated with, either 20 ml for size 3 or size 4 it is 30 ml. And with that amount of air, if you inflate the cuff, then this thing will come out, it will jut out a little bit for a few centimeters, maybe 1 or 2 centimeters, and that will ensure that you are actually in place. And then you just ventilate it like a bag and mask.
But like chances of bite of your fingers?
Usually for a comatose patient the chances are less, but otherwise we apply your mouth gags. So we apply any kind of mouth gag, either rubber, steel, or maybe 2 pieces of gauze to the either side of the tooth. Anything can be applied to prevent that, but mostly that hasn't happened much, because either the patient is unconscious or things like that. Because as soon as patient recovers consciousness, then it is difficult to maintain this with all the gag reflex, cuff reflex intact. Then it is difficult to maintain. Then you have to take it out.
Can we just show you a video of this element?
Size for each patient, and the patient weight does appear on the airway tube. Next, prepare the laryngeal mask airway by fully deflating it to a very tight vacuum. Contrary to some popular belief that there should be some air in the cuff, this is not so, because a filled cuff can come insertion by putting some gel or lubricant on the back of the cuff. Just on the tip of the back blade is all that is required. Insertion technique. Insert your index finger into the slot formed behind the flattened cuff and the junction with the airway tube. Then prepare the patient by tilting the head back and bring the tip of the laryngeal mask airway laterally towards the patient. Not downwards, but resting the tip behind the teeth and gums, because you're going to utilize first the hard and then the soft palate of the patient to perform a sweeping action that optimizes the anatomy as inserting the laryngeal mask vertically or obliquely brings about difficulties, but by following the curve created by the palate rather than bouncing off the back of the throat is by far the simplest method of effective insertion. So, ready now to start inserting the laryngeal mask airway. And there you see it, following the natural curvature, with the finger going as far as it can, and then using the other hand to stabilize the laryngeal mask as you remove the introducing finger. Then with a pre-prepared syringe, inflate the cuff. You will notice that not only is the cuff inflating in the pharyngeal cavity, but the connector is rising slightly, which is an indicator that the laryngeal mask has been inserted. The tip of the cuff is now sitting over the esophagus, either against reflux coming up, and the whole of that section is now completely filling the pharynx, which is a special feature of the laryngeal mask airway, because now the nitrous oxide or other gases are being directed solely through the trachea and into the lungs.